abuse. My panel from the University of Nairobi is here today to give us an overview of where we are and how we can start to mitigate some of these issues. Please welcome them, everybody. Good morning.
Good morning.
Good morning. I'm going to start at the far corner. How are you? Tell us who you are and what you do here at the university, please.
My name is Catherine Namlundu. I am a clinical psychologist working at the University Health Services, University Wellness Center, and I'm happy to be here this morning.
Thank you for being here this morning. And for you, sir, tell us your name and what you do.
Yes, my name is Macharia Njoroge. I am a mental health advocate. I work with an organization by the name Users and Survivors of Psychiatry, as well as I'm a student at the University of Nairobi, Psychology Department.
Thank you. And Dr.
Yes, my name is Dr. Muthoni Maathai. I'm a psychiatrist, senior lecturer at the Department of Psychiatry at the University of Nairobi. And I'm in the Kenyatta National Hospital campus. That is where we have the School of Medicine and the College of Health Sciences.
Okay. We've just taken a look at an overview, Dr. Maathai, as to where we are, but maybe perhaps you can bring us closer home, and specifically when it comes to younger people, students and such.
Yeah. Well, I think we've all seen an increase in the use of different substances and traditional ones, and even a wider range of substances being used by the youth today. And I think you've seen that in the last 2-3 years, there has been a big need in the country even to look at ways of resolving the problems of particularly alcohol abuse, alcohol dependence, we call it, and also the use of other drugs and newer drugs, which we actually didn't have. Like you could say 20 years ago, it would have been unusual to find people with heroin addiction.
Right.
Of course, we still did have some, but it was not very common. And right now, we are in a situation where we're even setting up special clinics, like a methadone clinic, to try and manage this problem.
Macharia, we'll speak to you, of course, about your own experience, but I think it's important that we take a look at where the university is and the kind of work that you have done over the years to ensure that you're curbing some of these issues. I love the fact that the university has a wellness clinic. I love that. Take us through that, Catherine. Tell us where we are.
Yeah, the university is aware of what is happening in the country, and living to his vision of being a world-class university committed to scholarly excellence, we have to cater for our students and our staff holistically. So we realize it's not about academics or the work. So the university has a wellness clinic. This clinic caters for the whole range, the psychological well-being, the mental health, and social issues of university staff, both students and their dependents.
Okay, you're going to tell us a little bit about IADA and how your department is spearheading that. But Macharia, you have a powerful story to tell. It has not been an easy journey for you to be here, but you are here, and that is what's important. Tell us your story.
Okay, I was hooked to alcohol and marijuana and cigarettes for more than 15 years. Back in my days in high school until the time I finished college, and I was in the chronic stage for around 10 years, and different interventions were applied by my family members. They tried several institutions, but I would always get a relapse, and I could have lost it all. But finally I discovered where the problem was, and with a lot of help and a lot of input, I was able to overcome addiction. And I've been clean for 8 years.
Wow.
My life has changed tremendously, and up to a point I had to again rejoin college and take a different course from what I trained on.
Okay.
From being an electrician into a mental health advocate and a psychologist.
Amazing.
Yes.
Macharia, when you look back at your life, particularly when you were using and when you were, I guess, under that spiral life, and look at your life now, the comparison and what you see back then, do you remember yourself even?
When I look back, I just see total darkness. The comparative here is between darkness and light. And I almost never made it because it was life-threatening. It was such a serious thing. And I always ended up in dangerous places. I was attacked by thugs. I had developed other habits so that I could sustain my addiction. I had to do some illegal businesses. I had to even pick things and sell. And I was always on the wrong arm of the law. And so many times I got arrested, then released, went through the same vicious cycle for quite a long time. And it was very painful for both myself and my family members.
Okay. Dr. Maathai, he represents many people in the country and families that are affected by this. At what point do you, as a mom, dad, lecturer, clinical psychologist, personally, at what point do you identify that it's no longer casual, the drinking, the smoking, and this has now become an addiction, it has now become a problem that's affecting this person? Where do you start?
I think, first of all, I want to point out that you really, when people start using substances, they always think it's a recreation, its peers are doing it, I want to belong, and they don't think it's a problem. But it continues to a point where you get to the stage where it impacts on your school life, your college life, your social life. You get new friends who you can stick with. So it's never really, nobody is born with this problem, but it's a problem that builds up with time when there is access. And some things, my take on this is some things you should just not start, like smoking. Nicotine is extremely addictive.
Yes.
You'll do it. It looks nice and it's it's harmless in the beginning, but it has a very rapid addiction, and it's almost a lifelong type of addiction where you're always struggling to get in and out. And then there are others who think drinking is harmless,
right.
and indeed it's a global thing, and a lot of people do drink alcohol, and it has no impact. They are what you call social drinkers, huh? But for some people, they lose this capacity to limit, either because of a certain personality type, or because maybe they have some type of biological predisposition to it, which might even be inherited from the family, maybe a family thing, or because they don't have coping strategies for stress. So they use these substances to deal with stress. Every time you're using a substance to deal with stress, then you have a problem, because that means you have poor coping strategies. A lot of our students, some of them don't use substances before they come to college, but because they're coming from settings where the access is not so easy, or boarding schools, and when they have here, they have access to everything. So this is really important that correct information is given.
Okay.
Yeah.
Macharia, looking at, of course, the fact that yes, you are a student, you are within the institution. Is it peer pressure? What happens? How did you spiral to that situation where it became life-threatening?
Well, it looks like a joke. Every young man or woman tries out things just out of curiosity and out of just to get to be happy. But then down the line, one does not even realize that he's getting hooked. And even when things are bad, when you have hit rock bottom, you only see other people are the problem. They're interfering with you, they're always patronizing you, they are condemning you for nothing.
Yeah.
And you don't realize the mess which is in you, in your life, and such now you become a dependent on everyone who surrounds you. You're not able to live an independent life, that is. Because I could not function normally. I could say function, as in I could not go around my business without having to use a substance. And you can't tell the timelines between now experimenting and hitting the rock bottom.
Right.
It's very tricky. But what I realize is that you start with some of the expensive drugs, but down the line, you go very cheap for you to, because you cannot, economically, you cannot sustain it. You cannot even sustain basic needs, like even food, it becomes a problem to so many people. And then there is a lot of stigma associated, and recovery now becomes difficult because looking back at the mess and now trying to reintegrate again with the community becomes a nightmare.
Okay, thank you for sharing that. Now, it's one thing when you have a wellness clinic, a team of psychologists and doctors at hand, but the same way you work hard is the same way the drug dealers are working hard to get these kids high. It's the same way bars are open till odd hours to ensure that they're there drinking and not focusing on school. Some of the interventions that you have undertaken over the years and how they have worked. Catherine, take us through that.
Yes, like the psychiatrist said, one of the major problems is lack of information or having the wrong information. So we have what we call the student assistant program and the employee assistant programs. Within these programs, we try very much to pass the right information so that we bring down the demand for drugs. Many of our students don't use drugs. And those are the people we are taking care of. We give them the right information. So out of curiosity, they don't experiment and go down because you don't know how far you're going to go. Okay. And there's this wrong perception that everybody is doing it or everybody has to do it at this stage. So we give the right information and we use other students. We train what we call student peer mentors and peer counselors. So they spearhead the message passing and interaction with their fellow students. Even for the staff members, we do the same because we have families who can also get into the problems. Okay. And then the few who have gotten into it, we are able to identify them. We do assessments. As it is, we work as a team. We have psychiatrists in the team, we have psychologists, different specialties of psychology. So we work together, even with the parents, if the problem, sometimes you may find the problem is at home. So we have sociologists, social workers who will reach out and try to bring this person back on course because the university cares.
Absolutely.
Yeah, it cares.
You know what I like that you've just said, and I think that needs to be the message, is not every student is doing drugs, and a huge percentage actually aren't. Let's focus on this demographic, Dr. Hari, for a second, and how this particular group of the non-users can begin to influence some of the users, and maybe perhaps from media to publications and different platforms can start to focus on the do-gooders. What can you say?
Yeah, you're right. I mean, the percentage of non-users is bigger than the users, you know, because we're also dealing with an intelligent group of people. Some people source the information and they decide that's not the way I want to go. They also others who come from very stable families. We do know that, of course, those who are not users, they also have initiatives, and we use them in our peer information. But even more important are those who have been there and have felt this is not the right way, because the users are more likely to listen to people who've had that kind of experience, right, like him,
Macharia
rather than somebody says, what do you know about it, you know,
right,
sort of thing,
yeah,
you know. And so I think it's important that we allow the students to form groups, and we have these kind of peer-driven groups and support groups. It has users and non-users.
Macharia, for you, why did you stop? When did you stop? Who was there? Who intervened on your behalf?
I can't say it is not easy, but I really received a lot of support from my family. Never gave up with me. They never gave up hope on me. And they took me to an institution, Teens Challenge in Kiambu. And that's why I discovered myself once again, because it was a holistic approach of treatment, whereby it was spiritual, it was nutrition, it was physical exercises, and due to a routine that reintegrated me into the normal ways of functioning as a human being.
Tell me a little bit about how you help people.
Okay, I do individual counseling.
Okay.
I do interventions. I speak to students in schools. I speak to youths in the communities. And I also do workplace trainings on alcohol and drug abuse.
Okay, fantastic.
Yes.
And now that your fellow students have seen you on TV, on the show, they'll stop you and talk to you as you walk to and from your lectures, isn't it? Hopefully. That's the thing we're looking for here. Now, as I said earlier, IADA, which is the day of marking anti-drugs, it's so important, is being done here at the university on the 23rd. Catherine, tell us a little bit about this day. And this is the first of many conversations on this show on issues that really affect the student body. Tell us about this day and how the university is marking it.
Yes, IDADA, the international,
the
International Day Against Drug Abuse and Illicit Trafficking, is a day which is marked worldwide. Since 1988, the resolution was passed by the United Nations General Assembly in 1987. And since then, it has been marked. It's 30 years old, as it is. And it's an effort the world puts together to reduce the use of drugs and trafficking of drugs. And the university is not left behind. As part of an advocacy against demand for drugs, we create awareness throughout the university community. So it's a one-week celebration at this University of Nairobi. It will start on the 19th, Monday. There are various activities which are going on. Starting the 19th, we have games. We have partners who have come on board. The International Yoga Group is coming the whole week. We're going to have yoga lessons.
That's great.
Yeah, throughout the university. You can join us, it's open.
That's awesome.
We have various campuses of the University of Nairobi, so we have activities.
Okay.
The climax will be on Friday, the 23rd.
Yes.
Where our Chancellor will be the guest of honor. We have our Vice Chancellor will be there. And all the university community will congregate at the Chancellor's Court. We'll start with a walk. The police band will walk with us around the city. We'll cause a bit of traffic that day, shouting and saying, yes, you can have a life without drugs, creating awareness, because that's what we do best. So it's open to the public. It's also a family fun day for the university, so that we come together and shout that you can actually have fun without drugs.
Absolutely. Yes. I love that. Thank you so much, my wonderful panel, for sharing the really good information today for so many who are watching. So what we're going to do is that we're going to connect you to the University of Nairobi, specifically the team that is spearheading this wonderful initiative. And if you have any information or you'd like to share and partner up, all you have to do is log on to our social media platforms and we will connect you to the relevant parties. And remember, it's all next Friday, okay? And we are going to be leading up to that day particularly. So make sure next Thursday that you are here. We're inviting everybody to come here on the show and to participate as we, of course, conclude for this particular topic. And then we'll pick up other topics. And especially for students at the university, we want to hear from you. We want to hear what you want to talk about. This platform is for you and also the faculty as well, right? Where we want you to interact because we've created this segment for you. Asanteni sana, Catherine, Macharia, and Dr. Maathai for being here. I look forward to many conversations coming through here, and please welcome more students to come and interact with us. Asanteni sana. For now, we say goodbye. See you tomorrow, everybody. Bye-bye.